Hello and welcome to Metabolic Balance. I am Dr. Sara, a naturopathic doctor here in Ontario. I have 20 years experience. I come from a fitness background. I absolutely love metabolic health, and I'm so excited to share a little bit about this program with you. My husband did Metabolic Balance. He started in January and he lost 40 pounds on the program, and it was so wonderful not only to see him improving his health and feeling his best, but his blood markers improved tremendously. So I am a huge believer in this program. I am excited to be your coach, and I'm looking so forward to helping you get amazing results in the next few months. Let's dive in. So, what is Metabolic Balance? It is an innovative, all natural, personalized nutrition program. There are so many programs out there, weight loss programs, metabolic health programs, hormonal health programs, but it is the cookie cutter approach. We put everybody into the same basket and we expect the same results. It does not work that way. We are all unique. And what makes this program so special is that it is based on you and your blood markers. So it is very personalized. It is going to lead to a new, invigorating lifestyle. So you can expect transformation in the next few months that will last with you for many, many years to come. So there's that successful long-term weight management that we see with this program. And also, what I love about it is that it does bring balance to our hormones. And this is an area that I've been deeply enthusiastic about for many, many years in my clinical practice, especially with my focus on fertility health. And I haven't seen another program work in such a way so naturally without any intervention outside of food have such a profound effect on our hormones. This was developed over 25 years ago by a doctor in Germany. And again, it is designed by studying the chemistry of one's individual lab values. So this is not a cookie cutter approach program. There are no prescribed injections, no pills, no shakes. I know sometimes people don't like gritty shakes or shakes that don't necessarily taste very good, proprietary foods. So there are some programs out there where you have to buy specific foods, and sometimes like a loaf of bread is $20. So there's none of that. It's natural food. You can find it in your local grocery store. And this is a program that absolutely anybody can do with commitment. You do need to be committed. So if you are not 100% committed to the program, this is not the right time for you. What to expect from metabolic balance. So, obviously, there's a long list of health benefits. Whenever you're doing any sort of transformational program, we do expect to see improvements, not only in symptoms, but in overall health. Weight loss, yes, we do expect you to lose weight. It is different for everybody. However, I'm yet to see somebody go through the program and not lose weight and not be happy with the results. Improved energy. So, if you're looking for that mid afternoon treat or cup of coffee, you can expect your energy levels to improve on this program. Better sleep, improved moods, so more balanced moods, less digestive issues. So, long term, we do expect to see improvements if you are somebody that does struggle with digestive issues. So, it is a gentle program on the digestive system. However, full transparency, the first 2 days is pretty intense. Like when I did the program, I was like, whoa, this is intense. So, definitely choose a time to start the program when you can be home and close to a bathroom, if you get my point. High success rates for long term health benefits and, of course, weight loss. Hormonal balance. So, those hormones, when we start to see them improving, we monitor them. And then, of course, more balanced hormones does translate into better health overall, improved fertility. If you are one of my fertility patients going through this program, improved immune function, and then a potential benefit for those who have PCOS, type 2 diabetes, or metabolic syndrome, which is essentially a combination of at least three conditions like obesity, high cholesterol, high blood pressure, or even high blood sugar. There are 4 phases to the program. So, the preparation phase, which is what I just mentioned, those first 2 days, yes, definitely pretty intense. It's detoxification. We're cleaning out and resetting your system. So, stay close to a bathroom those first 2 days. The next stage is stage 2. This is a strict phase, and it's at least 14 days. For some people, it can be longer, depending on how much weight you lose in those 14 days. This phase, again, 14 days, could be longer. Then we move into the more relaxed phase or stage 3. This can last up to months, again, depending on how long it takes to achieve your actual weight loss goal. And then we move into the maintenance plan. We will meet and have our consultation, our initial consultation. Typically, it's about an hour, could be longer, could be shorter. Then you will receive a requisition form from me that you can take to the nearest lab. And once I receive the results, this is just a sample of one of the pages that you will receive where you will get your personal food list. So, protein, carbs, it will all be listed out. So, this is just an example of how it's nicely laid out, very easy to read, very easy to follow. For the initial consultation, it is important that you complete the intake form on this important call. We will review your health goals, your health history, your medical history. We will review the pillars of health. And following the appointment, you will receive your welcome guide as well as your requisition form, which you can take to the lab and get your blood work done. Be sure that you are fasting. Following this, I will receive your plan and we will book your second visit. This typically happens within a week, could be a little bit longer, usually not shorter. The second appointment, we review your plan together. This is an opportunity for you to ask me any questions that you have to make sure you have clarity, to make sure you have confidence going into the program. So I do ask that you read over the plan at least 2 times, but I will always be available via messaging if you do have any questions that come up. You will select your start date. You will send me your start date so that I can keep note of it and make sure that I'm in contact with you, supporting you on this program. The third appointment usually takes place day 21 to day 30, depends on the person. We evaluate your results to date. It doesn't mean that you're moving into phase 3, but on this call, this third appointment is where I introduce phase 3 and phase 4 so that you have that information going forward. These 3 appointments are included in your package price. If you do want more consultations together, those are always available to you as well. This is a question that I get a lot. What is Metabolic Balance's success rate? So Metabolic Balance has a 60 to 80% success rate. That is absolutely amazing. Like, I am yet to see a program that has success rates that high. It is the only program that has a higher than 50% success rate in over 35 countries, and globally, it has the highest success rates. Another question that I get a lot is, how much weight can I expect to lose? So 5 to 8% of your total body weight during that initial phase. So the 16-day reset. So that includes phase 1, the 2 days, plus the 14 days in phase 2. 1 to 2% of your total body weight per week past that until an optimal body weight has been achieved. So for example, if your starting body weight is 180 pounds, that's 9 to 14 pounds during that 16-day reset period. Again, amazing. Like, talk about motivating when you start seeing results so quickly, and then roughly 1.5 to 3.5 pounds per week thereafter. What is included in the program? So yes, you do get your blood work. You get a complete personalized nutrition plan. This comes from Metabolic Balance doctors in Germany. You also get a special gift from me, so expect to receive a scale in the mail, and not just any scale. You get 3 personalized sessions with me, plus access to private messaging for 6 months, so that if you do continue, and I hope that you do, you can reach me at any point when you need my help and assistance. This is a program that works. There's no yo-yo dieting. This is a long-term, sustainable, transformational program, and you will always have your plan to revert back to if need be. This is available for $12.95 Canadian. This is the investment. Again, if you are in Ontario, we can break this up and you can get a portion of the program covered under your extended health insurance plan. I am looking so forward to working together and supporting you on this transformational journey. Congratulations to you. I'm so happy that our paths have crossed. I've been in the industry for over 20 years, and I've seen every program come in and out of my office over the years. And I can wholeheartedly say this is by far the best program for metabolic health. So, congratulations to you. This is a big step. It is an important decision, and I'm here if you have any questions. So, please feel free to reach out. My contact information is right in front of you, and I will see you at our initial consultation.